IBS. Okay. Yesterday we talked about IBS, irritable bowel syndrome, which is an important topic. Okay. Today we will discuss another important topic, that is malabsorption syndrome. What is called malabsorption syndrome. Okay. Whatever food you are eating, first digestion will happen, then absorption will happen, then defecation will happen, DOD will happen. But here in the malabsorption, the absorption will not happen properly. It may be decreased, it may be not happen properly. Okay. Due to that, the person develop many things, many clinical features will develop. Okay. What will the person will develop? Okay. Like his abdominal pain, he will have. Okay. Next, he have diarrhea. Okay. Next, he have anemia because there is a loss of iron, calcium, phosphorus, fat, important minerals, important vitamins. Due to that, anemia will happen. Okay, next, loss of weight because there is decreased absorption of protein also. We will have loss of weight and other deficiency also. Okay, so all these things will get into malabsorption syndrome. Okay, so basically in the body we will eat four types of food. What we will eat four types of food. One is protein, one is fat content of food. Second one is carbohydrate food. And third one is other substances like vitamin A, B, D. D is not there. Vitamin B, A, B, K, etc. Okay. So protein, fat, carbohydrates, and other substance. These are the four types of food we will eat and we will required by the body. So if there is an malabsorption, okay, what will happen if there is malabsorption? So if there is a malabsorption of fat is required by the body. So whatever body, wherever body need fat, you will get that problem. Protein also required by the body. If it is not getting to you, so it means that you will get decreased protein deficiency in the body, like fat, other substance also. Okay. So basically, first is fat. This absorption is take place in duodenum. Okay. How it is absorbed? It is absorbed by two things. One is by bile, which is secreted by liver, stored in the gallbladder, and released in the duodenum. And another one is pancreas. Pancreas have enzymes which will digest the fat. Okay. This is the first thing. Second is we have protein. Protein, it is hydrolyzed, means it is uh, circled by, if it is protein substance, it is hydrolyzed by pepsin, which digestive enzyme pepsin, and along with that pancreatic enzymes, both. Okay, both will help for digestion of protein, and it will converted into amino acids. Okay, this is the second thing we have to remember. And the third thing is what we have? We have carbohydrates. Carbohydrates are present in the food in the form of starch. This is 60%. Okay, and lactose, this is the form of carbohydrates, 10%, and sucrose in 30%. Okay, so this is carbohydrates. And the fourth one is other substance. Other substance like vitamin B12, okay, calcium, these are all absorbed in small intestine, large intestine also sometimes. Okay, so if any deficiency occurs while absorption, it may be fat, it may be protein, it may be carbohydrates, it may be other substances. So you will get that deficiency in the body, and that deficiency will cause the body will be affected with any type of diseases, any type of symptoms, any type of clinical features. Okay, why is this happening? Because of uh, in the gastric cells issues due to the gastric cells. First is or digestive enzymes, lack of digestive enzymes, and uh, damage of wall of small intestine, okay, and large intestine wall, okay, or deficiency of bile acid, the deficiency of pancreatic enzymes. It is the damage of gastric cells, deficient digestive enzymes, damage of wall of small intestine, large intestine, deficiency of bile acid, deficiency of pancreatic enzymes, okay, and decrease of bacteria, good bacteria in the colon, decrease of bacteria in colon, okay. These are the causes of malabsorption syndrome, okay. So these are the things you have to remember. And what are the clinical features you can see? Okay, the clinical features are mostly due to the mal absorption. The person development will stop, mental and physical development will stop, or it will in the same parallel way. There is non improvement, non decrease, and anemia, decreased level of blood in the body. Okay, and uh, cap bones, weak bones due to the deficiency of calcium and phosphorus, edema due to the deficiency of protein, cramps, and patient is in pale color. Okay, and his weight is decreased, low weight. Okay, and have always cracked skin, dry skin. Her tongue is pale, face and tongue is pale. So all this will have the clinical features of malabsorption syndromes. Okay, so how you diagnose is by the taking history, detailed history, asking the patient about what type of food you eat, how do you eat the food, okay, after eating food, uh, do you get the appetite, how is your appetite, all this will show, and and able to understand that the patient is malabsorption syndrome. Make taking complete history is very important by taking food, about appetite, about stool, okay, about abdominal pain, asking that, okay, and sometimes you have the radiography, that is barium meal radiography, or sometimes you need other examination like USG or enzyme test, amylase, lipase, or bile, or sometimes you need LFT, liver function test, how the liver is functioning. All this will make you the understanding about the malabsorption syndrome. Okay. Then come to the treatment part. So basically, after taking detailed history, you have to give three things here. Three things remember. That is again digestion, absorption, and defecation. In the gastrointestinal diseases, these three things are very, very important. Due to the GI, we have numerous diseases. Three things in the body is very important: gastrointestinal, then we have circulatory system, then you have nervous system, then you have endocrine system. After that, see if all these four are working good, then your body will have definitely a good health impact. First is GI. If GI not working, circulatory system will decrease working. Then the circulatory system decrease, you have nervous system issues. Then you have endocrine issues. Okay. So three things: digestion, absorption, and defecation. So you need to give to improve the digestion. S1, L1, RE, main important. For absorption, we have cell absorption is very important. We have S10, C10, WE, very important. And defecation, S last, VER1 or VER2 plus Y. Okay, these are the three common remedies you can advise to any patient for the GIT diseases. Okay, but specific treatment you will get after detailed history. If they along with that remedy, you have to give weakness, you need to give calcium deficiency, you need to give vitamin A deficiency, B deficiency, K deficiency, D deficiency. All this needed by the help of history. Okay, so basic treatment is that you can add upon this. Any other treatment depend upon the history. So this will improve the digestion, absorption, and defecation. So if any problems occur, like liver problem is there, you need to add S5 RE or S5 L1 RE. Okay, this will improve the uh, overall health of liver, or S5 L1 WE. Okay, if we improve the overall health of liver, if you have a problem in the pancreas, you need to do S2 L1 RE or WE, and need to apply the WE plus S10 on a whole abdomen and along with WE on the top of the head. Okay, to improve the connection between central CNS and digestive tract DT. Okay, so I hope you understood about malabsorption and advice to take a diet. Diet is also very important. You need to take rich, nutritious diet. Okay, this is very important. Rich, nutritious diet is very important. Along with you have protein in the food, fat, carbohydrates, and balanced diet. Okay, and water intake. So these are the important things you need to understood about malabsorption syndrome. Okay, this is all about malabsorption. If any doubts, you can ask. Thank you.